Hi, this is Dr. Evan Osar, developer of the Integrative Movement System. Welcome to these videos on low back pain. Again, as a massage therapist, one of the best ways to differentiate yourselves from the rest of the industry is to specialize. And one area that you can specialize and capitalize on is low back pain, because there's so much misconception and misinformation about low back pain, and there's a lot of people experiencing and suffering from low back pain. So in these videos, I want to share with you some of the myths and misconceptions, as well as show you a strategy that we developed to help low back clients and people that are experiencing even lower extremity and upper extremity problems related to the low back. So one of the first myths we hear and we often relate to low back pain is people have low back pain because they don't stretch enough. And we say, oh, you need to go home and stretch. Well, there's a challenge with that. Most clients don't have a problem because they don't stretch enough. They actually have a problem because they're unstable. Think about walking on a slippery surface. So again, you're walking through a grocery store and it's a slippery sign because somebody just spilled something or they just mopped. Is your reaction to walk tall? Is your reaction to walk fast? No, when the floor is slippery, you'll walk slower, you'll walk more hunched over. And if we think about our older clientele, our clientele that has chronic low back pain, they adopt a lot of the same postures and movement strategies. So what they're trying to do is get themselves into a more stable position. So when you see your client and they're having this forward head posture and the forward shoulders and they're sort of compressed down, what they're basically telling you is, hello, therapist, I am unstable. This is my stable posture, and my ability or my challenge is to create more stability for my body, so I'm adopting this posture. So the first myth about stretching isn't necessarily true. These clients need more stability, not more length per se. They need length, but they don't need to stretch to get that length. They need to be more stable, then the body will start to give you more length. Okay? The second myth is clients have either weak abdominals and or weak low back muscles. And it makes a lot of sense because the fitness industry perpetuates that, medical profession perpetuates that, rehab perpetuates that. You need more core strength. Well, the muscles that surround our low back, the abdominals and the low back muscles, have you ever palpated them on your low back pain clients or your clients that have chronic pain? Do they feel flaccid and soft, or do they feel knotted and rock hard? As you know, they feel knotted and rock hard. Guess what putting more strength into that area does? It compresses the spine more, they get more spinal compression, they get more gripping and guarding around their low back, hence they actually get more low back pain. Yes, strengthening may help some clients, but for the majority of clients that have low back pain, more strengthening actually makes them more painful. So the myth of having a weak core is sort of a myth. It's actually clients have a dysfunction in how they use the muscles around the core. If we look at the skeleton here on this image, we want to have the rib cage aligned over the pelvis. So if we drew a square or rectangle around this area, we're talking about the thoracolumbo-pelvic region. The thorax sitting on top of the lumbar spine, sitting on top of the pelvis. This must be a canister type effect. So if you look from the side, we should have a canister around the thorax, the pelvis, and the low back. In order to align the posture up, most of our clients are in this type of posture like that. That's where they're getting their stability, so they look like this. And then we, as therapists, we learn that most clients have a lower cross syndrome. So we say that they have too much extension here, too much anterior pelvic tilt, but a lot of our clients that are in this hyperlordotic position, they're actually hyperlordotic at the TL junction, the thoracolumbar junction, not down here at the lumbosacral junction. So releasing this more and more forces the client to have to use more and more of this strategy. So it looks good from a postural standpoint, but it actually compresses more and causes the client to then become hypermobile through their low back. They lock this area up and start to flex their low back. So again, the clients that have the anterior pelvic tilt really don't have an anterior pelvic tilt, many of them. They actually have a forward pelvis syndrome and a hyperlordotic thoracolumbar junction, therefore disconnecting their thoracolpelvic canister. So what we want to show you in the next video is how to get them to restabilize their thorax over top their pelvis And then in the third video, we'll show you how to integrate so they can activate the right muscles to create pure and optimal core strength and stability. So I hope that helped you clear up some of the misconceptions about low back pain. In the next video, we'll show you how to release some areas to get the thorax lined up better over top of the pelvis. This is Dr. Evan Osar. Hope you enjoyed this video. Catch you next time.